My story is one that began when I heard Kennedy's words. Ask not what your country can do for you, but instead ask what you can do for your country. Yeah, I was only a kid at the time, but I really truly believed that if I chose to give back to my local and national and global communities, that somehow everything would be okay. And now I'm not really so sure. I have a master's equivalency degree and state teaching credentials. And with all of that, I dedicated my life. I made a choice to teach. Then I made a second choice after a couple years of teaching in a public school that I wanted to give back to private school, to Catholic Christian education. So I decided to work in private schools. I knew very well that the financial rewards and the benefits would be less than in a corporate world, and definitely even less than they would be if I were working for a public school. I realized that. But I was always a frugal person, and I never expected that at this point in my life, my search for individual health insurance after those 30 years of teaching would be so very difficult. Right now I have monthly premiums of close to $868 a month. I'm trying to work on that and get it reduced somehow. With co-payments, yes, I have a trip to the emergency room for a couple stitches is going to cost me $150 minimum. Prescriptions, that's another story. I also have what's called a labeling now. I'm a high risk for several reasons, but one of them is because I have something called foot neuromas. That's a result of standing on my job for 30 years. And I have to tell you, I'm frustrated. I know I should be very grateful that I'm able to afford these costs at this point, but it's getting more and more difficult. My monthly premium I was just notified in 2009, it went up 32% because I crossed a magic date line as far as my age is concerned. After 30 years, when I retired, I really hoped I could do some of the things I didn't have time to do, like some painting and some music for myself and a little bit of traveling. I'm not talking about extravagant things here. But that's looking like it's not going to happen because it's taken everything that my husband and I have in retirement to pay medical bills. I saved. We were frugal. We don't have credit card debt. We don't owe people things. We made good choices. All of the savings get only the very basics right now. I color my own hair, do my own pedicures. My husband does the same. We use coupons. At this point, rather than just complaining, I'd rather get together with a bunch of other people who believe the same as I do. We're experiencing the same difficulties when we believed we were doing everything correctly. Count me in for all that help, anything that I can do. My name is Karen from Indio, California, and I demand health action now.